Okay. Hello, Emily.
Hi,
So nice to see you again. I just came from a primary care provider appointment. I had an MRI done on my shoulder because you had suggested that I should probably go get one done. And they had the results ready. She kind of gave me a little bit of an explanation, but honestly, I wasn't really taking in a lot. Do you have them available? And if you do, can you kind of explain them to me again? Because
Sure.
I don't really know what's going on.
Okay. I'm sorry you don't know what's going on. I'm sure that sounds super like easy feeling. But yeah, no, they did send them over to me, so we can definitely go over those together if you want.
Perfect.
Okay, so image is here. So they did a couple different views on it, and basically, like, you see like those little like white circles. So basically, what those are is those are little. All we know as of right now is that they're little masses, kind of in like the middle part of your shoulder, like right here. So you can see there, like that's your shoulder blade, and that's like your humerus or your arm bone. So they're kind of just sitting in the middle right there. So that it does explain a lot, and that does explain why we've been working together for a few weeks here, and we haven't really seen changes.
Okay. When you say like a mass, you mean like cancer? Like a tumor?
It's hard to say exactly what it is at this point in time, just because an MRI can't tell us that. But all they do know is that like there are little masses there. But in terms of like knowing for sure what that is, there's definitely going to have to be more work to kind of give you a definitive diagnosis on that.
Okay.
Do you want to talk about what those steps look like?
Yeah, because I have no idea what that's gonna look like.
Yeah.
I don't know.
Yeah. So given all that, what's probably going to happen is that your PCP will, I can communicate with her and kind of, get us all on board together and kind of get us on the same page, because I want her to be communicating with you, especially if she's going to be referring you to other places.
Yeah.
So what would probably happen, what would probably happen is she would get you in touch with potentially an oncologist, so someone who works potentially with cancer patients. Not to say that that's what you have, but what they can do is they can go in and take a piece of the tissue. Have you heard of what a biopsy is before?
It sounds familiar. But...
Yeah, so they're basically going to go in and gather a piece of that tissue and test it for sure and see what it is. So that's where they would know for sure. I know this is really nerve-wracking.
Well, I've been dealing with this for 7 months. Like, why didn't they do this to begin with? Why didn't I get an image to begin with? I feel like a lot of time would have been saved had they just done an MRI.
Like right from the beginning? Yeah. No, I feel that. That's frustrating.
Yeah.
It's tough though, because most of the time, like 90+% of the time when people come to me, it's typically a problem that can be fixed with what we're doing in here.
Yeah.
So it's not where, like, especially insurance companies, they're not going to want to dish out all this money right away just to have an MRI on everyone. So that's typically where like the initial care of physical therapy works really well most of the time. And in this case, we didn't notice any changes in your condition, and that's a huge reason why I referred you out for more imaging anyways. So it's more the fact, like, this is kind of just how things are in the system. I know it's really, really frustrating and not ideal.
I guess, yeah.
And to be fair, your condition that's not initially where my head went. It's not where most of our heads go,
So you're saying this isn't very common?
I wouldn't say it's common.
Okay.
Yeah. And luckily they found it quickly. And to be fair, it's like we're talking right now as if it is cancer. It's a scary word. It probably isn't, to say the least. Like I said, I don't know for sure, but it probably is not statistically. So, but they're gonna know for sure. Okay.
So they're just gonna like take it out afterwards? They're just gonna like remove it, or like what do they do?
So let's assume the best case scenario here, where it's probably either a cyst or something that is just a growth or mass or whatever, and they're just going to take it out and it's not going to be a problem. So that would be after the biopsy. So they would probably go in, remove whatever masses are there just to get rid of that block, right? And then probably what they would have to do is just, especially if it is into the bone a little bit, because the image does look like it goes into the bone some, is probably fill some of that and just make the bone nice and smooth and normal again. And then you'll probably come back to me after that point. So pretty speedy in comparison to like your whole process.
Yeah.
But like I said, with the biopsy and the alternative, that's where you would have to have a conversation with an oncologist, and where there's lots of treatments.
Okay.
Okay. Yeah.
That sounds good.
That makes sense.
Yeah, I think so. Thank you.
Yeah.
Perfect.
Can you even